Dr. Jeff Harp from Highland Family Medicine is with us. Good morning, doctor. Good to see you. Happy New Year.
To you too.
And right on cue, we are talking about resolutions. We'll get to some COVID resolutions in a minute. First, though, let's talk about New Year's resolutions. How many folks make them? How successful are we?
Well, probably the best study about this was done a few years ago by the University of Scranton, and they found that about half of people usually make New Year's resolutions. Of those people, maybe about 30% are still successful 2 months later, and by the end of the year, perhaps 10 to 15% of people are successful.
So many things, as we know, have changed during the pandemic. What about New Year's resolutions?
Well, actually, a lot of websites have been talking about this, and it looks like more people made them this year than usual. Probably up to about 2/3 of people made resolutions this year. Now, interestingly, the most common most common resolution was to work on one's mental health. Second most common was physical health, and usually physical health, weight loss, exercise, and so forth is the top one. So mental health sort of took over for physical health. And then the third most common, made by about half people, is to stay in closer contact with friends and family.
How do we keep these resolutions?
Well, first of all, we should choose something relevant, something that's going to make a difference now, not something that doesn't pay off in the long run, or doesn't pay off until the long run, I should say. Make sure it's something specific. So if we're working on mental or physical health, for example, say we're going to do yoga or we're going to walk, not just that we're going to be more healthy. Choose something that's realistic. If you're doing yoga, you need to have a place to do it. You need to have a platform to do it. If you're walking, you need to have the time to do it and a place to do it. Create measures. So instead of saying I'm going to do yoga, say I'm going to do yoga once a week. Instead of saying I'm going to walk, say I'm going to walk a mile a day. Be accountable. Get someone to ask you, how's it going? Or keep a list of how you're doing and check it occasionally.
Last question here. What guidance do you have for those who didn't make a COVID-19 resolution but would like to now?
Well, I'd suggest asking ourselves 3 questions. The first would be, what positive has come out of the pandemic that I want to keep? What do I want to keep doing in my life? For example, safe health and sanitation practices. Also, what have I lost? What am I not doing now that I want to be doing? And try to add those things back in, like exercise or the arts or spending time with family. Finally, how would I change the world if I was in charge? What would I do that would make things better in my neighborhood, in my family, in my state, whatever? Especially important now, as you might know, we just crossed the 10% mark in Monroe County. We're more than 10% positive. That's the first time ever, and it really makes sense to think about how can we get through this together? How can we make resolutions? How can we support one another, learn and change together as a community in order to beat this?
Great finishing point, Doctor. We'll leave it there. Thank you.
You're welcome.
Resolutions, COVID resolutions. If you missed any of our conversation, we'll have it online as well at rochesterfirst.com.